All right, our viewer question today is they have asked, what are your recommendations for helping get rid of rosacea through a whole food plant-based diet or otherwise?
Oh my, we've got to talk about both whole food plant-based diet and otherwise because they're both usually necessary. Rosacea is such a stubborn and often disfiguring skin condition. And you've seen people with, people are probably too young if you're viewing this to remember an old-time comedian named W.C. Fields. And he was a caricature of a man, but he had this big red bulbous nose as part of his trademark, and everyone thought he was an alcoholic, which he was. But it turned out the man really had rosacea on his nose there, and that's what caused that big bulbous appearance. The name for that condition is called rhinophyma, when rosacea creates that large bulbous nose appearance. But you can get rosacea all over your face and on other places as well. The proper name is acne rosacea, and it has some commonalities with acne. I think it's made worse by certain foods, certainly the pro-inflammatory meats and sugars seem to play a role here, and yanking those out are really important. Whole food plant-based, underline whole foods. If I were flirting with rosacea, boy, there'd be, even though they're vegan, I wouldn't be eating vegan baked goods and ice creams and those kind of treats for a number of reasons. But again, it floods they're basically sugar and fats, and usually not terribly healthy for us. And most of the vegan processed foods, the vegan ice creams, etc., are going to have oils and concentrated sugars. So again, fall back in those whole plant foods. You really want to emphasize fresh foods. You want a big salad every day. Like Dr. Furman says, the salad is the main dish. And so have a big salad. That's going to be helping your skin in a number of ways. And I think gluten may be playing a role here. If I had rosacea can be so disfiguring, I would pull out all the stops, and one would be to stop eating gluten. It clearly plays a role in psoriasis and other skin conditions, but I would certainly consider giving myself say a 3 to 6 month break from gluten. I would stop eating foods that might increase gut permeability, the so-called leaky gut. Stop drinking alcohol, stop taking ibuprofen. You might want to stop chlorinated drinking water, or at least get a water distiller or something. You want to be nice to your microbiome down your gut there, and chlorine, the drinking water, can reduce it. And again, this is if you're flirting with a rosacea outbreak. If your skin is healthy, you're a healthy person, it's okay just to drink filtered water like we have in our house. But if you've got a condition where a healthy gut wall is absolutely essential, I'd even consider getting a water distiller or reverse osmosis to get the chlorine out of the water. So all of these things are meant to really increase the purity, if you will, of the food stream. Would any supplements help? I would consider taking some extra zinc, 15 to 30 milligrams of zinc in a supplement. And here's a place where you really want to make sure your skin oils are as beneficial as possible. So we're talking about those good omega-3 fats. So every morning we've got a jar in our fridge, got a jar of ground up flax, chia, and hemp seeds. A couple of tablespoons of that goes on my oatmeal every morning, goes on a salad in the evening. I'll crush up a handful of walnuts, and that goes on my salads and soups every day. So I want lots of omega-3 fats in my skin oils. So as far as diet-wise goes, those are the main considerations. Now, there seems to be an infections component to this, and there are skin bacteria, certain strains of Staphylococcus and Streptococcus get down into the hair follicles and cause infection. And I think that really needs to be dealt with as well. So when we talk about whole food plant-based diet and other things, among the other things is this is such a challenging, to be nice, skin condition. It can be devastating. I pull out all the stops, and now we know that some topical antibiotic agents, something like metronidazole gel, these clear gels, get down into the skin pores and kill off the bacteria and really can be beneficial. So here's where a visit or two to a skilled dermatologist to get a prescription and some guidance. You don't need to go and drag yourself into their office every week, but get an assessment and get a prescription for one of these topical antibiotic gels. I'm hesitant these days to prescribe oral antibiotics for this. They can be helpful, but for the damage it may do to your microbiome, I really prefer that people try to deal with this topically. So get on that healthy, whole food, plant-based diet. Take a little extra zinc. Make sure those omega-3 fats are in your diet. This might be a place for say 6 months if you're a young person of some algae-derived DHA to get more of that into your skin oils. But find your local dermatologist to give you a prescription for one of these topical gels. And with a little luck, you'll see that rosacea fade away, and you can smile at that person smiling back at you in the mirror, and get on with your life with healthy skin. I hope that helps. Hi, everyone. Dr. Michael Klaper here, announcing our new format for our Q&A with Dr. K. Annie Hagen will be asking me one question that's been sent in by our viewers. So if you want to see if your question is getting answered, do join us for our Q&A with Dr. K right here. Hope to see you then.